We've all heard about the dangers of taking a family member's medication, but a recent study found a surprising different source for pills. We often don't discuss this. People are taking medicine meant for their pets. Question is, what could go wrong if you did take those drugs that were prescribed for your dog or, say, your cat? Here to discuss this is the star of Amazon's Pet Doctors of Atlanta, veterinarian Dr. Arvid Edward. Welcome, sir.
Thank you.
Now, it's interesting. I want to say, have you ever had to deal with this with your patients? But really, it's the parents of your patients you have to be worried about.
Right. Absolutely. Absolutely. And it's interesting that this has become such a new thing. Because I talk to people and they say, people really do that? And I'm like, yeah. And it's pretty common. So as veterinarians, we're easy targets, first of all, for people that are seeking control drugs. So you get pets that are, oh, my dog has anxiety, or you know,
Are you serious?
I think some people have heard that before, right? But, you know, if they're taking plane travel or thunderstorms, you know, fear of phobias, you know, I'll get people calling asking for Xanax, or, you know, people that, and this is sad. I've had clients inflict pain purposely on their pets so that they can come in and get tramadol.
And then they take their pet's
their pet's medication and they're abusing it.
Is there an easy way to tell as a vet if and when this is happening?
Yeah, we go through screening. Well, there's a pharmacy class that veterinarians are required to take every 2 years that help reiterate how to screen out those that are seeking controlled substances. Okay. So there's questions that we can ask. I don't want to throw out my whole arsenal. Then people come in.
I got you.
I know your trick now, but there are ways or questions that we can ask to try to figure out if these drugs are being misused, or if the client is actually coming in getting these drugs, you know, with the intention of them taking them themselves. Right. Yeah.
Well, Baylor College of Medicine did a study looking at antibiotic use, and in that survey, it came out that 4% of people said, yeah, I've taken my pet's antibiotics when I ran out of my own. Right. So these aren't controlled substances, but my question then is there a different formulation for, say, my dog or horse's antibiotic? Would I metabolize it differently as a human? How does that work?
Absolutely. The thing with antibiotics is quite scary, actually, because now we're building up this not just nationwide, but it's becoming a global problem with bacterial resistance. And a lot of it is because people are misusing, taking antibiotics, not completing the full prescription, sharing antibiotics between friends and family members. But your question is right. The metabolism in humans versus pets are different, so we break down medications differently. So, for instance, Cipro, or ciprofloxacin, that's a common antibiotic that's been used in humans for like urinary tract infections. When in dogs, the bioavailability definition, that's the proportion of a drug that when enters the circulation is active to treat the infection that we're intending to treat. So that's what bioavailability means. But the bioavailability in dogs versus humans is different. So that drug in dogs, we have to prescribe a higher dose, because by the time that drug gets broken down, the percentage of that drug that's left, you know,
so in other words, you can easily take way too high of a dose, not to mention the fact that you don't, as a human, just want to be popping random antibiotics as though you know what you're doing with them. You know, is the take home here, and maybe the better question is there any recourse as a veterinarian? Because you catch your clients taking their pets' meds, beyond saying stop it.
You try to scare them. You know, their antibiotics, let's say enrofloxacin. Although it's done a great service to a lot of industries, the internet, I think, as far as the medical community is concerned, has become a little of a handicap, because people can now go on the internet and look up drugs and compare. So if I prescribe enrofloxacin in one dog, they can go and look and say, oh, that's in the same drug class as Cipro, it must be okay for me to take. And I'll just scare clients. I'll just tell them, like, look, you can take that enrofloxacin if you want to, but when you're at home watching TV and a polka dot elephant walk across the room with Superman, don't come personally.
And there is the takeaway. If you don't want polka dot elephants walking across your room, do not take your pet's medicines. It's a true danger out there. And Dr. Edwards, thank you for sharing that with us. We really appreciate you coming on the show.
Absolutely.
Stick around, everyone.